Well, I think a primary care physician can be thought of as your health manager, the person you go to see when you initially have a problem or for routine health care. And, you know, symptoms often overlap for diseases, and so patients often will have symptoms and they won't know what specialist to go to. So go to your family doctor, your team manager, talk about what's going on, and usually we can, if not address the problem completely, at least get the workup started and then get you in to see an appropriate specialist. Well, I think it's a good idea to have someone who knows you, knows your family, knows your health background, so that when you come in, you feel like you're at home, your medical home, and you're not just another person running through an emergency room. We have your background, we have your records, we know what medications you're on. Well, you have to feel comfortable with that person because you're going to share a lot of sensitive information. And so you have to feel like that doctor is someone who will listen to you and include you in your health care, not just dictate to you what you should do. I think that you need to feel comfortable with that doctor, and if you feel that you are not being validated by your physician or not listened to, then seek a second opinion, find someone else. I can't know everything. No particular doctor can know everything about all of medicine, and so that's why we have specialists. Then there will come a time when a patient will have a problem that is beyond my scope of practice, and I think that that's where the specialist comes into play, help me solve that particular problem, and then return the family back to their home. Well, I think it's important because if a patient needs specialty testing or procedures, it's nice to be able to have a place to send them where you know you're going to get the report, you're going to be kept in the loop as to what was done to them and what follow-up is needed. I think it's one of collaboration. I'm not the boss of you, and it's your body, it's your health. You know yourself better than anyone, but you're not trained, but patients aren't trained in medicine. So if we work together, I can use my medical knowledge and you can use your knowledge of yourself to come up with an answer. I want people to have healthy lifestyle habits, make healthy choices, and do things to stay well. And I see that as a big role in helping direct people to change some habits that aren't as good for them as others could be.
For more information about this physician or to schedule an appointment, please call our referral line or visit notbiggerjustbetterhealth.com.